Actually, before we do, let me close the poll so I can tell you what you've selected for next month. So in October, oh no, we have a tie. Well, that's tragic. Okay, so we have a tie between, well, let me see the number of votes. Maybe it's just a percent. No, it's exactly the same number. So we have a tie between acceptance and commitment therapy for skin picking. And what's the second one? Just one second. Self-worth, self-compassion, and skin picking. So let me see if I can reopen the poll. So because everyone voted. Oh, crap. Pardon me. I will relaunch the poll. So whoever is here, you get another chance to vote again. Hopefully we can avoid a tie. So go on and vote, and I will go to the Q&A. And then we'll check the results when we finish. Okay, so the first question is not a question. It says, this is the enemy Satan trying to interfere with your helpful studies. Oh, it's because of the noise. Well, apparently Satan left after a while, so I'm grateful even to Satan if I can do this in peace. Because this microphone is very sensitive and then picks up all kinds of noise. I find whenever I'm frustrated, I pick, how do you handle frustration? So I hope that at least some of this is helpful for you in terms of how do you handle frustration. But if you need like a first aid help for frustration, I would immediately, like, that depends, I guess, on what frustrates you and where you are when you're frustrated. But if you do that at work, I would suggest just taking a break. Sometimes, like, for example, when we work on stimulus control techniques, so in different ways to prevent the urge from arising in our program, we talk about how to implement small breaks at work so that you don't become frustrated or so that you don't become too exhausted, because that's when picking is likely to occur. So taking breaks would be one thing. Breathing exercises are incredibly efficient. So if frustration is mild, you can try grounding exercises. They work very well for things that are not terribly overwhelming, but breathing exercises like box breathing, for example, if you do them for 3 or 4 minutes, they should be able to alleviate a good amount of frustration. And then, of course, once you settle your body, once you're calm, go back and reflect on what caused the frustration. And when I say go back and reflect on that, what I mean is go and think what part of your approach wasn't functional. Any suggestions on scars? I'm not sure I quite understand sort of what kinds of suggestions you mean. So I'm not a dermatologist. I mean, I'm a doctor, but not for skin. So I don't like to do the job of dermatologists because I just don't feel confident. It's not my area. So it might be better directed at a dermatologist. Sorry, I mean, unless you mean something psychological, but then please clarify. Can you please elaborate a bit more on the fear component of emotional expression? Oh, you mean the slide where I gave you a few examples. So this is from Kelly's book called Psychology of Personal Constructs, I believe from volume 2. The way that he looks at emotions. So when we think of fear, we always think of what we're afraid of. So we will say fear of flying. Well, I will think of a book if you say that, but you know, like fear of mice or whatever. So we think of fear in terms of what is the external object of our fear. But Kelly, because he's interested in how we actually get to grow and change from our emotions, he's interested in how to translate them in psychologically useful terms. He always looks at fear from sort of inside the person, like standing in the shoes of the person. Because what does it mean to be afraid of flying, for example? It means that you're afraid of the implications of that for your life. If you're afraid of a mouse, like a mouse can't hurt you. I don't even know if a mouse can bite you. And yet people can be terribly scared of them. So for Kelly, the solution is never in the mouse. The solution is always in what that mouse represents in your mind. This is why he talks about fear as needing or having an impending change in a part of who you are. because that mouse somehow shows that there is a part of you that overreacts, or there's some sort of meaning attached to that that's not functional. So this is why he talks about emotions in those ways. This is why he doesn't say emotion is a free-floating, he doesn't say anxiety is a free-floating fear, or whatever the definition is in psychiatry, because for Kelly, this is useless. For Kelly, it's only useful if it gives you information so that you can change. Otherwise, he's not interested in it. This is why some of his definitions seem kind of upside down. So for example, when Kelly talks about anger, he says, anger is the awareness of invalidation that leads towards hostility. Well, it's not Kelly directly, but it is a constructivist definition. So he doesn't say anger is a reaction to, I don't know, something external or internal. He says that anger is an awareness of invalidation. So it means that whatever the assumption is that you had in the beginning of an encounter with someone, that has been invalidated. And then when he says it leads to hostility, he's also telling you what choice you're making. So your assumption has been invalidated, and instead of changing your assumption, you're actually about to go and try to bully the external world into conforming with your will. So his definition of anger or any emotion will tell you what it means for you internally, for the structure of your system. This is why I said that the definitions themselves are not important for you to remember, but the mechanism of thinking is very important. When someone annoys you, like you turn on the news and you know, whoever annoys you in the news, you just see that person and then you become terribly angry. Very likely you're going to say it's because this person's a liar. But a lot of people lie, and people will sometimes lie, and we probably lie. I mean, everyone is told to lie. Like, that's just a fact of life. And yet we don't react angrily to every lie. So there's something specific that lie means to us, or that person represents to us. And Kelly is interested in, let's say you see a news anchor you particularly hate, because that is something that people tell me about. Like, they have very intense feelings for news anchors. This is because this person embodies something that you sometimes maybe not recognize in your behavior, but there's potential that you behave that way. So Kelly will say, investigate it like that. Because you cannot do anything about the news anchor other than turn off the TV, but you can do something about yourself, right? He would always advise you to learn so that you can restructure yourself in a way that you become more resilient. Hence, his definition of fear doesn't really mention any object of fear. It just mentioned that fear implies that a part of how we see ourselves is not really working well. If I see myself as a strong person, but I don't know, freak out when I see a mouse, you know, there's some internal work to be done there. So this is what Kelly's intention is. Can you repeat the name of the book, please, and the author? So I'm not sure which, so let me, if it's fiction, the book that I mentioned was Unbearable Lightness of Being by Milan Kundera. So it's not about skin picking, but it is a book about relations and how we deal with emotions and how we manage boundaries in relationships. It's quite a good book, and a lot more than that. So that's what you mean. If you meant the psychology books, I mentioned The Psychology of Personal Constructs, which is Kelly's 2-volume book. It's like those 2 great books there. Proudly, I own the first edition. Thank you for the webinar. Could you please share the slides with us afterwards? I will share the whole, so all of it will be uploaded to YouTube. So you will receive 2 links, one with the webinar and then the other one with the Q&A. There's not much here about feeling the need to pick my skin. It's about emotions, not urges. Yeah, so the title of this was Working with Difficult Emotions, not specifically with the urges. But if you're interested in learning about working with the need to pick, we've had a whole webinar devoted just to that. And we talked about why is it that people feel the urge and how to understand the urge in a similar approach. Something that I hope Kelly would have approved of. So if you go to our YouTube page, you can find it was like 2 or 3 months ago that we had that webinar. I would gladly repeat the webinar, and if you want to. Also, if you have any proposals for next month, I see that some of the proposals have been submitted, but if there's anything in particular that you'd like to hear about, just let me know, and then I will add it to the list so people can vote. I realize that this is about emotions, but the need to pick is often difficult to separate from emotions. Absolutely. I think in general, very often these verbal labels that we attach to emotions like fear, anger, guilt, threat, whatever, they're not always really very appropriate to define what we're feeling. This is why I said just you don't have to, even when I work with myself, and certainly when I work with clients, I don't necessarily tell them that they have to define their emotions in any way that society tells us that we should divide our emotions, because they're really very amorphous. And then I agree, they're kind of like a continuum, and it's difficult to separate. What I do suggest is don't stop with positive versus negative, because this is not very informative. And don't try to define your emotions in those terms like, I feel uncomfortable, because that's very vague. Like, how's that useful? I feel uncomfortable, therefore what? Other than to escape the situation, I don't see how it provides useful ways of defining. But you can come up with your own language for emotions. I think I've given this example before, but for example, sadness in general, for me, is not one feeling. I mean, I know that other people refer to it as one feeling, and I know what the psychological definition of it is, but in my personal experience, I prefer to separate it into two different feelings. One that has this intense flavor of pathos and just kind of heavily sentimental, like those beginning chords of Tchaikovsky's first concerto, like tacky, how intense it is, like rolling on the floor and crying sad. And then there's this other kind of sadness that sometimes I hear in I don't know, like in fado music, the Portuguese folk music, or in certain types like Cuban son or boleros, or I don't know, Chopin. Like, it's also sadness, but for me, they're qualitatively completely different. I treat them differently, I work with them differently, and they mean different things to me. So you don't really have to pay much attention to what an official definition of an emotion is, or even use the words that people use. Just invent your own. Because ultimately, this is just one way in which we delimit one aspect of our nonverbal experiences from others. And that's always an artificial division. The need to pick can also sometimes be an emotion, looking at it this way, because sometimes anger will trigger you. Sometimes you will be anxious half of the day, but you will ignore that anxiety, and then slowly it will mutate into the urge to pick. So I absolutely agree that it's very difficult to separate, and sometimes not even possible. So come up with your own definitions of things. If you have a therapist that you work with, your therapist should be able to pick up those, like when he wants to explain yourself, they should be able to use that, and then you can work with that. I think it's healthy to encourage people to develop their own language, because ultimately only you know what your experience is like. The only thing that's important is not to lump everything together, because once you lump everything together, avoidance remains the only option. But when you separate them into at least several categories, then you can find different ways to deal with them. Is depression an emotion? Often I feel down, but cannot define or clarify. I don't think it's related to my picking. So it can or cannot be, I guess. I mean, I trust your assessment since you're you. So depression technically is a mood disorder, and a difference between an affect, an emotion that arises, and your mood is simply a matter of duration. So you can say that it's an emotion that's stretched out over time. But people will often talk about depression as being like something that they feel for one day, let's say, or like a few hours. So in that sense, we're not talking about a clinical term, but we're talking about a specific flavor of low mood. So you can define it as an emotion for yourself. It's perfectly legitimate to treat it that way. Just make sure to kind of differentiate it from depression as a clinical entity. Do you deal directly with skin pickers? Well, I don't call them skin pickers, but yes, this program is for people who pick their skin, so yes. Have you met any people that have successfully stopped? Yes. What helped them? Therapy, among other things. What was the first step they took? It sounds like a lot of this comes from mindfulness. So there's a lot of questions here. Okay, so what was the first step people take when they try to? Let me answer you, since we're talking about SkinPick and since they basically sponsor this and allow us to meet. So let me explain how it works in the program. And I happen to think it's a good approach. So in SkinPick, you start off by doing habit reversal training, which essentially has this component where you collect data and learn about different aspects of picking, and then you learn how to implement certain behaviors to substitute picking. So this is not going to resolve the urge to pick, but it will give you a degree of healthy control, and it will allow you to minimize damage and help your skin heal. So that's the basic first step. And then after that, you can dive in deeper and work with the urge and find a different way to relate to it and reverse other avoidant mechanisms. But the first step is always to take control practically, because if you reduce your picking or stop with habit reversal altogether, you will allow your skin to heal, so there will be fewer triggers to begin with. So that's a good place to start. If you cannot, because SkinPick is not a very expensive program, but nonetheless, it does cost. If you can't do that, you can, I believe it's up on the website. You can go to the website and you can subscribe to a free course, which is essentially habit reversal training that we made available for free. It's not exactly the same way it's implemented in our program because you don't have a therapist that you work with, but it's a self-paced and self-guided program that if you follow the directions and don't rush through the program, that you can find certain solutions on your own. And then you can see what works and what doesn't work. And then if you decide to start the program, you'll have a good basis. And if not, you can work through it on your own. You can also find people, like we have recently, we started a Facebook page. It's moderated, so there will be no offensive comments or anything like that. You can find people who would like to be your accountability partners and then do this free program with them together. So that's one way to start if you don't want to invest money or don't have money to invest. It sounds like a lot of this comes from mindfulness. So there are several, that is absolutely true. There are several reasons for this. First, because I'm also a mindfulness teacher. So that's just a tool that I have in my toolbox and that I like to use. Second, there's a lot of evidence that it works. So mindfulness-based techniques are among the most empirically tested techniques. So we know that they're effective, at least for people who practice them continuously. This is why I always say that mindfulness is not first aid. It's like a way of life. It's literally something you incorporate in your lifestyle. And also another reason is because mindfulness is integral to, at this point, to all types of modern cognitive behavioral therapies. Acceptance and commitment therapy implements mindfulness in different ways. Dialectical behavioral therapy implements mindfulness. So mindfulness is kind of everywhere in contemporary psychology. If it were up to me, I would talk about constructivism day and night, but that would make this something else other than what it is. So mindfulness seems like a good tool because you don't need a therapist to learn how to meditate. You don't even need a lot of expensive resources to learn how to meditate, and you can help yourself quite a lot by just practicing that. And also one of the reasons that I like it is that my personal belief, and you're all free to disagree with me, is that CBT has this emphasis on symptom reduction. This is all nice and fine and dandy, but in the past 20, 30 years, psychology has kind of lost its way of looking at depth and complexity of people, and we kind of focus on removing symptoms. So I miss the days that I wasn't even born in, when they were active, like when constructivism was all the rage, or psychoanalysis or interpersonal therapy or any kind of psychodynamic therapy, because I think we miss this kind of more meaningful way of looking at human beings. So to me, mindfulness, because many people won't go, like in my private practice, I have people who come to therapy for a long time, and then we work really in depth, because in my private practice, I'm not going to limit myself to CBT, which is what I do in SkinPick. But mindfulness is like getting a little bit of that depth on your own without having to go to therapy for a very long time. If you couple mindfulness with journaling or some sort of structured reflection, you can learn a lot about yourself, about what motivates you, what causes you to feel a certain way, because mindfulness is just sharpening your natural tools like awareness and concentration. So you can learn a lot about yourself. So it's an additional bonus. It regulates your emotions. It lowers your anxiety levels. It makes you resilient to stress. It's actually the most efficient stress reduction thing that we know of. And in addition, you actually get some of the introspection that I think is lost when we focus only on these kind of symptom reduction techniques. So this is also a reason why I like mindfulness, because it enriches us. How do I prevent nighttime picking? I have more self-control during the day because of being occupied and being more calm. But once it becomes nighttime, I go crazy with skin picking, especially after midnight where I'm more anxious. So if you're talking about picking in your sleep, then wearing gloves or some sort of stimulus control is the only thing that I can think of, because you cannot, because some people actually pick in their sleep. So in that sense, you're not conscious. You have to go for stimulus control techniques. And if you're talking about picking like after work or at night when you're awake and doing something else, then I would not say that you're more calm during the day. It's just that you're really not in touch with how uncalm you are. I just invented a word, I think. So people usually have a tendency to pick more in the morning or in the evening, because when you're not preoccupied with other things, this is when your brain goes crazy with thinking, and this is where you become tense or whatever else, and then you resort to picking. So I would suggest a relaxation technique, and then finding a way to separate the free evening that you have from work. So you can do that by, I don't know, like I would, for example, what I personally do in my everyday life is once I finish work, and what I will do once I finish this webinar, is that I sit and meditate. And then for me, mindfulness is like a cutoff point between my working hours and the rest of my day. And that also allows my body to calm down, because when you talk, work, do all kinds of stuff, there's a lot of tension that builds up. And this allows me to release the tension. So it doesn't have to be mindfulness. It can be a breathing exercise. It can be some sort of relaxation technique. It can be some sort of physical activity like running, anything that will involve cardio, so to get a lot of that energy out. And then you should be able to have a freer evening. Of course, you can use stimulus control as well. And I don't know if you're in the program or not, but competing response techniques would be a must, obviously. You can strategically place them in those areas where you might pick. Can picking be hereditary? So we have zero evidence that it is. And in fact, we have no evidence that body-focused repetitive behaviors are hereditary at all. In terms of empirical, like no one, there is no study to my knowledge that has shown anything like this. I've seen some studies that show, for hair pulling, not for skin picking, that show a certain correlation between some variants of genes that are related to grooming and hair pulling. But this study is just basically found a correlation, and correlation doesn't really prove that something is hereditary, only just the two variables change in a certain way together, nothing else. So there's no evidence of that. We do, however, see skin picking in families, and this is not rare at all. But in that case, I think especially for psychotherapists, it's much more pragmatic to think in terms of patterns of behavior that we internalize, because we like to reduce things to genes, because then it kind of, it's no one's fault, it's just genes. But it's a much better way to think in terms of behavioral patterns, because we learn how to deal with our emotions by looking at people who raised us and by listening to what they tell us. So very often, hair pulling, for example, I will have clients who will tell, female clients mostly, who will tell me that they saw their mothers pull their hair, or even in some situations that their mothers pulled their hair. Like, so that's how it started. So when we're young, we're like sponges. We just kind of absorb everything. And then we tend to try out behaviors that we see in others. And then even if we don't have the memory of seeing them actually very often, and then once we realize what effects it has, we just continue to use it because it's the only tool that we have. So that's one way to explain something without having to resort to genes. I'd like a webinar with a dermatologist who will present descriptions of skin, what's normal, what we do to our skin, especially long-term, to try and use some factual reference to help us. So I feel pretty like I can do a webinar on how our, like the one that's listed here about how our skin works and how skin heals and why picking does. So I can do that webinar. What I don't feel comfortable is giving advice that a specialist should give, but anyone who graduated from medical school can give you a webinar on what you listed here. So if it gets voted out, if it gets voted 1 month, I would be happy to do the webinar. I can even try and find someone who might, like if you want a webinar specifically for a dermatologist who can help you in managing scars and stuff like this, I can perhaps see if I can find someone who would be able to do that. I can't promise that, but I can certainly try. So I will split the topic related to skin next time into 2, and then you can vote for whichever one you prefer. Can you share the information or the link to the Facebook group you mentioned? So email me and I'll send you the link, because the page is called Skin Pick. So you can just type in Skin Pick. I don't have the link on hand here because I don't really particularly like Facebook myself. I actually registered on Facebook recently only because I want to be active in the group, because sometimes people ask questions and then if I have some free time, I will probably just check in and then try and answer them. But it's very hard to build a habit to use Facebook because I detest it in so many ways. So just type in Skin Pick. I really don't need to go into my feelings towards Facebook. I think it antagonizes people. Okay, so I read something that I was not supposed to read out loud. Oh, that was, I suppose, this. Also, thank you for your compliments. I'm reading them. It's just that reading compliments out loud kind of makes me feel like a douche, just kind of, I don't know, raising myself is just a little weird. Let me scroll down and see. So there are some topic proposals for future webinars. You talk about mindfulness, and it really is awesome to practice mindfulness, but how do you make a habit out of it? It's really easy to stop doing it. Yeah, this is a common thing that I get, even not only from people who try to implement mindfulness because of their mental health, but also when people approach me to learn mindfulness, like without any particular reason, they always find it difficult to implement it in their daily routine. One thing that you can do is to attach mindfulness. Most of us have a morning routine. Like no matter how simple it is, most of us have it. Like at least you have to get out of bed and brush your teeth. Like that's at least the basics. So if you implement mindfulness in the middle of your morning routine, it's more likely that it will stick, because you already have an established pattern, and then you're just kind of stacking one more habit on top of those that are established. So that's useful. That's how I do it. So when I practice, again, this might not work for you, but I have 2 mindfulness sessions per day. One, when I wake up, I have a meditation cushion that's basically between my bed and my bathroom. So in order to get to the bathroom, I have to at least trip over the cushion. So I will sit and do my morning meditation and then proceed with the rest of my morning routine. And then when I finish work, I will have a short meditation session just so that I calm down and leave my work at work and go downstairs and continue my day. So that's how I do that, because those are some points in my day that I cannot avoid. I mean, other than that, you can just obviously set alarms or try to practice mindfulness in groups. This tends to enhance the experience, and it does help you motivate and stay with it for a long time. How can you keep your own boundaries, like sleep time, video game time, dieting, exercise? So that's a huge question. And the answer depends on why you have struggled to maintain boundaries. Like, it makes me want to ask if you by any chance have ADHD, because one of the things that people who struggle with attention have is that they also have an issue about sort of structuring their day. Because what you're asking me here is not even about boundaries in the sense of like limitations or interpersonal relations, but about how to introduce structure in your life. So what I said about mindfulness just a second ago, I think applies. Whatever routine you already have, add something to that routine and never try to add more than one thing at a time. Because the biggest mistake that people make, even when they start the program and when they start implementing habit reversal training, the first thing they will do is say, let me try these 12 techniques at the same time. That almost always backfires. Our psyche is very inert. So this is why we have habits, so that we can do things without thinking, and our psyche likes that. It's economic, sorry. So in that way, start one by one. Start with whatever your priority is. Like sleep time, for example, might be a simple one of those that you listed. So the first thing you do is spend 1 month just trying to go to sleep at a certain time. And then if you have trouble sleeping, like do the basics of sleep hygiene, which is don't work in the space in which you sleep. Your space for sleeping should be just your space for sleeping. For example, what I said about going downstairs when I finish work. I do not stay, like I like my office and I will like it even more when I hang the rest of the artworks that I have, but I have this wonderful, you can't see it, chair here that I work on sometimes, and there's like a little espresso machine, there's all kinds of stuff, and I'm self-sufficient while I work here, and there's obviously a bathroom here. But once I'm done with my working hours, I do not visit the second floor of my house. It does not exist. I'm just downstairs, because this is only for work. And the same thing is for the bedroom. It should be for sleep and some other activities, but not for watching movies or reading books or anything else. So that way your mind will know that once it gets to bed, that's for sleeping. And I know that this may sound like a weird advice, but it actually works, because habits are formed in specific contexts always. Even picking is not entirely random. Even when it seems that you do it everywhere, there's always a context that supports the habit. It's just that the context might not be a chair. It might be like an emotion or something like this. So you need to kind of limit sleeping time to the bedroom. That means no cell phones around the bed, sleeping at a specific time. And then in the beginning, you struggle to fall asleep, just try either those self-hypnosis, what people call meditation for sleep. That's not meditation, but it does put you to sleep, or melatonin or whatever else. So then you do that. Once that habit is established, move on to something else. Just don't try to do more than 2 things at once. And if you do 2 things at once, try to connect them one with the other, because habit stacking is one way to make introducing habits successful. Thank you so much for your helpful information. Well, you're welcome. I'm going to read more on Dr. Kelly. Please do, by all means, because Kelly is a complete genius. There's not a single psychologist that has been so original as he has. He's really, really wonderful. But because he invented a whole new language to talk about humans, like I told you about his sort of approach to emotions, but in over 1,000 pages of his book, you won't find a mention of emotions, because he talks about transitional states. So he kind of invents a whole new vocabulary, which makes him very difficult to understand, but it's worth it because it's like a treasure trove of wisdom. May I ask where you studied? I'm a nurse coach who's getting ready to enroll in a graduate program. So I went to medical school in Europe, so at the University of Belgrade, and I trained at the Institute for Constructivist Psychology there. And then I was licensed first there, and then I got my European certificate, and then I came to the States. So by the time I came to the US, I was already a trained therapist and a doctor, so there. But in terms of, so there were a few, so if you're in the UK, in Italy, in Europe, you have a lot of training centers for constructivist psychology. In the US, I'm trying to think. So there was one professor who's really very good, Spencer McWilliams, but I believe he's retired now in California. There's Professor Niemeyer, but I forgot where he's teaching. If you email me, I will Google and let you know, because there have to be a few training programs in the US, but not many of them focus explicitly on constructivism, unfortunately. It's just, you will get CBT more or less wherever you go. So that's unavoidable. Another clarification about a proposal topic. So to hear about things like everyone has some blemishes, it's normal when you squeeze your pores, this and this happens. and similar type topics. Okay, so this is the topic that's already proposed. I think it's the last one on the list. Our skin function and significance, what's normal and what's not. So I think that webinar would be incredibly useful, but it always ends up at the bottom of the list. So apparently there's not a lot of demand for it, but maybe now after this, there will be. I agree with you. That would be a very good webinar to have. So I see that there are some questions, and some of you, I have your names. What is Kelly? Last name you've spoken of. So yeah, it's a last name. George Kelly. George Alexander Kelly is his full name. So he was a US psychologist. He died in like late 60s. And the book that I keep referencing was published in 1959. So it's still in print, but he's not like a new name in the world of psychology. So this is kind of an established theorist by now. He was really quite brilliant. So there you go. Let me see if there are any other questions that practicing rain seems more complicated. Is there a place where we can learn more? So yeah, if you want to learn more about practicing rain, there's a whole book about rain written by Tara Brach. So much for the silence. The book is called Radical Compassion. She has two books. One is called Radical Acceptance, and then the second one is called Radical Compassion, and Radical Compassion is about rain. So you have a whole book on this. And if you go on to her website as well, she has a number of talks and guided meditations and quite a lot of resources. As I said, I'm a little bit ambivalent about her. Rain is a terrific technique and it works very well. It's just that for my own personal tastes, her teaching is slightly kind of sugary. Like, for example, for avoidance, she will use the term, the trance of unworthiness, which is like a mouthful and has its kind of poetic potential, but I kind of feel strange telling my clients, well, where what you go into is actually a trance of unworthiness, because it makes me sound like they have an epileptic seizure, and they don't. So she uses these kinds of terms that I don't always like, but her books are really very good. So if you can, just kind of avoid the language, you can find a lot of useful stuff. And I've also heard her speak a few times. And so she's really, in terms of like how she guides you through meditation and the things that, she's also a clinical psychologist. So she's a therapist too. And she's a very, very, very good teacher. So that's highly recommended. And then obviously Sharon Salzberg's book. But in general, like there's always mindfulness courses tend to be cheap. Like at least people that I know that teach don't charge a lot. I don't either, because it's usually like a group effort, so it tends to be affordable, but you can also learn it for free. Like if you have any Buddhist monasteries or meditation centers around you, any Buddhist monk will teach you for free. And they will not indoctrinate you, so you don't have to become Buddhist, but they will teach you how to meditate. And they tend to be, in my experience, better teachers and safer teachers than a lot of psychologists, because unfortunately, many people who will teach or recommend mindfulness don't actually practice mindfulness. And there are a lot of mindfulness coaches out there, or life coaches, who have zero knowledge of psychology at all. And plus they don't meditate. So they really don't know how to kind of navigate the issues. And people who struggle, skin picking is not necessarily going to cause any adverse effects. But if you have PTSD or bipolar disorder or some sort of psychotic disorder, it's extremely important that you're guided by someone who knows what they're doing. And even though Buddhist monks are not usually psychotherapists, Buddhism, so not as a religion, but as like as a philosophy, has a very elaborate and complex approach to psychology. So they all know what to do and how to help you and how to teach you. So basically, there's no reason why anyone would have to pay for it at all. So that's a free resource. I see some of the other questions. If I didn't get your question, just please email it. Let's just close the poll for now, because it's been 2 hours and I'm losing the ability to speak at this point. Let me see what won. I don't know why it used to mark it in red, but this latest update ruined. Okay, so acceptance and commitment therapy for skin picking 1. So this is what we will be talking about in October. So acceptance and commitment therapy for skin picking. I will try to make it practical and see see if there's something that you can apply even if you don't participate in the program or have a therapist or even want a therapist. So I'll try to make it practical because acceptance and commitment therapy can be digested in rather simple terms. So thank you very much for sticking around for so long in such large numbers. You have my email here on the left. So I see that there are some questions that I didn't get to. Please just email them to me and I will get to them by the end of the week. So thank you for your attention and hope to see you in October.